Dear colleagues, allow me to present a report on the topic Combined Probiotic for Women Effectiveness and Safety from the Point of View of Evidence-Based Medicine. Over the past decade, there has been a notable rise in the prescriptions of probiotics, as confirmed by our analysis of scientific literature. According to the GVP market report shown on this slide, the global probiotic market is projected to increase by an additional 14% by 2030. Importantly, the application of probiotic today extends far beyond treating antibiotic-associated diarrhea, irritable bowel syndrome, or intestinal dysbiosis. Evidence from clinical studies support their use in restoring the vaginal microbiota as part of integrated therapy for psychocognitive disorders, for optimizing GI function, and as a adjuvant treatment during chemotherapy with anti-tumor agent. As highlighted in the study by Difei Yao, visible on this slide, 48% probiotic prescription are issued in surgical department, while 42% are attributed to internal medicine. A decisive factor in probiotic therapy has become a fundamentally new approach to dosage of probiotics. The dosage of 2 to 10 to 20 million colony-forming units of beneficial bacteria, which was used in probiotic product during the first 50 to 7 years of clinical practice, is now considered ineffective. To achieve a therapeutic effect and restore the microbiota, it is currently recommended that probiotic formulation contain no less than 10 billion CFUs. A more effective direction in probiotic therapy is the use of combined probiotic formulation. Current preferences are given to combination of various lactobacillus strains, particularly in gynecology, as the use of such probiotic combination allows for the restoration of both the intestinal and vaginal microbiomes in women. Another key issue is the availability of a solid evidence by confirming the clinical efficacy and safety of probiotic bacterial use. Today, it has been clinically proven that a healthy vaginal microbiota includes specific strain of lactobacillus, such as Lactobacillus crispatus, gasseri, iners, Jansenii, acidophilus. Those particular lactobacillus strains are recommended for preventing pathogen invasion and for the treatment of vaginal dysbiosis, including candidiasis. The aim of our study was to analyze the clinical efficacy and safety of combined probiotic product for women from the standpoint of evidence-based medicine. As a model, we select the probiotic Florium A, which contains lactobacillus capable of restoring both the intestinal and vaginal microbiome. Given that Florium A is a combined probiotic formulation, we decided to conduct exploratory and analytical research of each of its individual components. A total of 157 scientific publications from the database shown on the slide were reviewed. Inclusion criteria were based on the relevance of each study to the keyword listed. Lactobacillus crispatus is a dominant species within the healthy cervical vaginal microbiota of women. It produces high amount of lactic acid, exerting a bactericidal effect of pathogenic bacteria such as Candida, Gardnerella, and others. Studies have shown that Lactobacillus crispatus facilitates trophoblast invasion by enhancing the activation of matrix metalloproteinases MMP1 and 2. When Lactobacillus crispatus predominates in the endometrium, it creates optimal condition for implantation and early placentation. Lactobacillus crispatus normalizes vaginal IL-1 alpha level, reduces local inflammation, and promotes epithelial integrity. According to numerous researchers, Lactobacillus crispatus is considered a biomarker of vaginal health and has the highest potential for restoring and optimizing the vaginal ecosystem. Additionally, its capacity to normalize intestinal microbiota has also been demonstrated. The next component of Florium A is Lactobacillus gasseri. Unexpected clinical findings regarding Lactobacillus gasseri were presented in the study by Nishida. The authors demonstrated that even short-term use, just 1 week, of Lactobacillus gasseri at a dose of 2 billion CFU or more improve clinical symptoms associated with stress and irritable bowel syndrome. Importantly, Lactobacillus gasseri exhibits bactericidal activity and significantly reduces the presence of pathogenic bacteria, both intestinal and vaginal, as shown on the slide. This effect is related to its ability to suppress CLD's activity, modulate the expression of TNF-alpha and IL-1 beta, decrease myeloperoxidase activity, reduce bacterial adhesion, and inhibit biofilm formation. Numerous randomized clinical trials also confirmed that oral administration of Lactobacillus gasseri helps normalize the vaginal microbiota in women and contributes to reduction of visceral fat in obese adults. A recent double-blind, placebo-controlled clinical study by Shavada and colleagues demonstrated that Lactobacillus gasseri positively affects mild menopausal symptoms, increases level of calcitonin and serotonin 2A, reduces deoxypyridine in urine, and improves vaginal epithelial health. The next component of Florium A is Lactobacillus jensenii, which, according to numerous studies, play a key role in urinary tract health. Lactobacillus jensenii suppresses the growth of uropathogenic bacteria. A decline of vaginal Lactobacillus jensenii is associated with a significantly higher risk of urogenital infection, including Neisseria gonorrhea. It has been shown that Lactobacillus jensenii produce two protease-sensitive components similar to analase that prevent the adhesion of pathogenic bacteria of epithelial cells. Lactobacillus jenseni also produces biosurfactant and prophages which further block bacterial attachment to epithelial tissue. Additionally, the Lactobacillus jenseni strain, as shown on this slide, influences TLR signaling pathway, reduces inflammatory responses, and positively affect the human immune system through cellular and molecular interaction with intestinal, epithelial, and immune cells. This strain also downregulates the expression of pro-inflammatory cytokines and chemokines. As an immunobiotic, Lactobacillus jenseni may also be effective in inflammatory bowel disease. The next component of Florium A is Lactobacillus rhamnosus, also known as LGG. Over the past 2 decades, extensive preclinical research on LGG has provided profound and unique insight into how this probiotic strain may influence human health at the molecular level. Most notably, LGG has a proven effect of modulating the immune system. LGG effector molecules regulate the immune tolerance by interacting with macrophages, lymphocytes, antigen presenting cells, and intestinal epithelial cells, ultimately increasing the production of secretory IgA. Vaginal dominator of Lactobacillus rhamnosus strain is associated with a lower risk of genital infection. Furthermore, LGG significantly reduces adhesion of urogenital epithelial cells and disrupts biofilms formed by Candida, Gardnerella, and other pathogenic. It has been established that LGG exhibits pronounced antioxidant properties. LGG effectively and progressively reduces the impact of cationic radicals, including malondialdehyde, and enhances the activity of glutathione peroxidase and superoxide dismutase. Equally important is the LGG ability to modulate GABA receptor expression in the brain, producing anxiolytic effect and potentially contributing to the treatment of depression and other stress-related disorders. LGG is also capable of producing beneficial substances such as 5-hydroxytyramine, short-chain fatty acid, brain-derived neurotrophic factor. In addition, LGG can regulate brain activity and enhance neurological function via the vagus nerve, the GLP-1 signaling pathway, and more. The final component of Florium A is Lactobacillus acidophilus. In just the past year, the international database PubMed has indexed 129 scientific publications dedicated to the study of Lactobacillus acidophilus. The body of clinical research of Lactobacillus acidophilus confirms its broad pharmacological potential, as illustrated on the slide. Another interesting fact related to use of probiotic combination in women is their positive effect on skin health. The skin improving effect of probiotics includes anti-photoaging effect, skin whitening effect, anti-wrinkling effect, skin moisturization, body odor reduction, and anti-aging effect. And important consideration is the choice of optimal dosage form. The clinical efficacy of oral versus vaginal administration of probiotic continues to be actively discussed. It's necessary to determine whether the use of oral probiotic in women with vaginal dysbiosis is clinical appropriate. A meta-analysis by Cook et al. Reviewed 23 randomized clinical trials involving more than 2,000 women with diagnosis of recurrent vulvovaginal candidates. The finding indicated that topical probiotic preparation did not show superiority over oral administration in restoring vaginal microbiota balance. Moreover, the use of oral probiotic in women with vulvovaginal dysbiosis also led to normalization of the intestinal microbiota. To summarize the result of our analysis, we can conclude that an effective combined probiotic should meet the following criteria. Combination of lactobacillus, optimal dosage, availability of evidence base for each component, and optimal dosage form. A probiotic product that meets all of these criteria is Fluorium A. Fluorium A is a complex of clinically proven lactobacilli. It supports the restoration and maintenance of urogenital health by enhancing immunity and normalizing both intestinal and vaginal microbiota. It was an honor to share the result in our research with such a distinguished audience. I hope that the data presented today will contribute to a deep understanding of the role of probiotics in women's health and open new perspective for clinical applications. Thank you for attention.